We're going to keep our remarks brief in the spirit of this conference, which is to have these workshops be mostly discussion. So let me give you a brief overview of the background for this work, for the organizing that's being done in the states and the policies that are starting to become implemented. And then I'll pass it to our other panelists to talk about what they're doing in Minnesota and California, and wrap up by talking about what we're doing in Washington State. There have been a number of campaigns in recent years in a variety of states to improve the care infrastructure. Obviously, this is a long movement that really thrived with the paid leave movement for the last 2 decades since the turn of the century. But in recent years, it has become broader. Many of these efforts have drawn inspiration around both policy design and framing and organizing from a concept known as universal family care. As Elaine mentioned, the Academy did a study panel on this topic. The concept was supported in the field by Caring Across Generations, and both the Academy work and Caring Across's field work was supported by the Ford Foundation and shepherded by Anna Wadia, who's here today in the workshop. UFC, I'll just briefly cover some background for those of you who are new to it, is guided by a few key principles. The belief that improving our care infrastructure is possible, that long-term services and supports, paid family medical leave, and early child care and education are insurable risks, meaning these are expensive risks that we all face, but by contributing a small amount from each paycheck, we can finance benefits to address these needs. It's guided also by the principle that our families experience these needs and these risks as interconnected. So it's often the same person, an adult in their prime caregiving years, for example, who's caring for a child and a parent at the same time, or at the very least helping the parent start to begin to navigate a journey that could be awaiting them in that long-term care space. It was guided by the principle that there are synergies to addressing these needs and these risks together. One of the main ones would be simplifying the user experience, because as human beings in our families, as members of families, as caregivers and care recipients, being able to access one program instead of 3 programs to address these needs would be more efficient. And in fact, each of these policy domains often involves multiple programs that beneficiaries have to engage today. So simplifying that user experience would be important. And finally, it was guided by the principle that states have an important role to play, that often experimenting at the state level and tweaking what hasn't worked, building on what has worked is a promising approach to getting to a bigger policy win. So universal family care would be a new social insurance program to which everyone would contribute and from which everyone would benefit, much like Social Security or Medicare. It would encompass child care, paid leave, and long-term services and supports benefits. Work would be the foundation. The vision here is this would be a social insurance program at its core, where people contribute. It's contributory. It would be, and I'll talk a little bit later about why that's important. It would be flexible and portable and cover people across jobs and across the lifespan. It would provide a single access point, for example, some kind of beneficiary portal online that people could access benefits through. And it would also take into account the need to invest in quality care jobs. So the idea being that it would exacerbate inequality if we were to invest in benefits for people needing care without also investing in the quality of the jobs of the people providing the care. So there are 2 broad structural approaches through which universal family care could be implemented. One would be a contributory social insurance approach. It's classic social insurance, where only the contributors are eligible for benefits. And this could be done through contributions alone. Another would be a more comprehensive approach, where you find an additional revenue source, for example, other dedicated taxes. And of course, there's a number of types of taxes that people have considered in recent years to fund social spending. And so you could have an additional dedicated tax, or you could have a general fund subsidy going to the program in addition to its contributions, to allow the program to cover everyone, not simply those who are contributors. So those are 2 broad structural approaches that have been considered. With that, I'll pass it to Deb to talk about what's going on in Minnesota.
Hi, everybody. Deb Fitzpatrick with Children's Defense Fund in Minnesota. Thanks, Ben, for laying out that framework, which I have found to be quite helpful and inspiring. And wanted to share some insights from Minnesota and how we have been thinking about all three of these policy domains and thinking about how we move into using a social insurance model or thinking about social insurance as a way to proceed. So in Minnesota, like many states, we have really active both C3 and C4 efforts in all three of the policy domains. And I think this is probably true in many states since these are all really public challenges. And although our other speakers are lucky enough to have one or two pieces already in policy, most states are not there, having kind of none of the above or trying to think about how we're making transformational change, right, in all three of those domains. In Minnesota, our paid family and medical leave, like Ben mentioned, has been the most active, organized, and arguably most successful of those three domains. We've been actively moving a policy over 6 years, had it included in the governor's budget, passed our House twice, passed our Senate once. And in that domain, we've been able to really, I think that's an area where the social insurance approach is already well understood, right? Because that's the way most states are doing it. It's a natural fit. But in Minnesota, we also are lucky enough to have a very functional UI system. And that's actually been really helpful for us because we are able to build our paid family leave policy heavily on our unemployment insurance structure. And so there's like a built-in natural understanding of that as a social insurance program and then building paid family leave on that. And I'd be happy to talk more about that in Q&A if people are interested. And then in the long-term care space in Minnesota, we are, there's just been a lot of interest, a lot of different kinds of proposals, crushing budgetary demands for the state to figure out a long-term solution. And just this year, a policy, much like the UFC policy, much like Washington state's with a trust fund and a payroll contribution payment mechanism has been introduced. I don't think that's going to get hearings this year, but it's definitely now part of the conversation in the state as well. And then finally, I wanted to talk mostly about childcare because that's an area where obviously the Children's Defense Fund is heavily active. And I think it's the least well-developed of the kind of policy domains that are included in UFC in terms of thinking about a social insurance solution, right? I'm heavily active in a number of national coalitions working with a lot of national funders in the childcare space. And we have really been working both on a local level and a national level to kind of bring forward this idea of social insurance as a funding solution. So Minnesota, along with many, many states, there are definitely coordination challenges within childcare in that domain, but there are also tremendous funding challenges. And there's a tremendous movement nationally to get people working in the early childhood space to start committing to thinking about how we can raise the dedicated revenue that we need to fully fund a transformative universal childcare approach. So in Minnesota, we have been doing that work, pulling people together in our early childhood advocacy space. We convene a group of around 150 advocates every week. And we've really been socializing the idea of social insurance as a mechanism to think about how we might get that dedicated revenue that we need to fund the system, but also thinking about how it's coordinating with the other needs of families as Ben laid out so well. Last election cycle, in Minnesota, we had a lot of C4 work in our state, and I think that's growing across the country to build the political will kind of around a vague, broad care economy, care infrastructure agenda. However, once we get past that kind of broad narrative that, is fairly powerful and fairly easy to answer, I think it is really then when it comes down to the nuts and bolts on how we might actually move ahead in a policy way that brings these things together, I think that's where we're still missing a lot. And UFC is an incredible opportunity, I think, to again, bring people together around something that might actually work. And we in Minnesota, like many places, really without some kind of unifying kind of framework for actually delivering on that narrative, really face that danger of having the needs of one group pitted against the others in terms of this care, the whole care continuum. So, in Minnesota, we also find that many of the advocacy groups and key players in each of those three policy domains are similar. So there's many players that are at least in two domains. So our AARP, for example, in Minnesota is very active on our Paid Family and Medical Leave Coalition, and also very active in the long-term care space and working closely with the author on the payroll tax approach. And, CDF, very active, as I've already mentioned, both in the childcare space and the paid family and medical leave space. So there have been lots of opportunities to think about how we're creating these bridges and how we might use this particular framework as a way to get beyond just the broad narrative, which is we recognize there's care across all the things Ben mentioned, right, around how people in the real world and voters perceive the need for care and don't think about it in these buckets that we often get stuck in, depending on which state agency or which, kind of advocacy lane you're in. So I think that, we are getting to a place where I think we're going to be able to maybe bring folks together around this. And I just wanted to wrap up by saying a little bit about COVID. I know that that's obviously been, both a challenge and an opportunity for many of us in Minnesota. As I mentioned, we are quite lucky that our unemployment insurance system actually worked. And was able to really deliver for people. And it's become quite a great talking point for us around what social insurance is and how it can work. And so we've been able, like I said, and we always have really tried to think about how we're building on people's commitment to that approach to think about social insurance. But I also, every hearing we have, we're moving our paid family medical leave bill through our legislature right now. And at every stop in that process, we start with a social insurance 101. So we're starting to build that kind of political knowledge about what social insurance is and how it has many of the benefits that Ben outlined. And then finally, again, as we are childcare is never been hotter. It is the #1 issue. Our Chamber of Commerce, our business community is all on it, and it really is a powerful moment in the childcare space. But I think we are still struggling with how we pay for it, and so I think we are again being able to kind of bring this lens, bringing this kind of contributory. Earned benefit approach into the space, and which is just really different for childcare. But I think there's a lot of potential there. Really excited to be, like I said, working with a lot of national organizations, funders, coalition building efforts to kind of bring that social insurance lens into that childcare space. So I'll stop there and be available for questions. I think we're turning it to Christina next.
Thank you, Deb. Hi, everybody. My name is Christina Boss Hamilton. I was, until late last year, the legislative director for a union that represented in-home care workers. And so I've become very familiar over the 10 years I was at UDW with long-term care issues. And so I'll just say really quickly, our work started, I want to say, in about 2017. So basically, in California, the aging and disability communities are fairly well organized. They were not the best at working together. So I'm kind of going pre 2017. You know, there wasn't the best history of working together. The unions that represent the home care workers, I want to say we did have good relationships with the other stakeholders, and there was a general kind of unity and recognition that all of us were sort of in this together. When we were facing the 2018 gubernatorial race, we all recognized that there was now an opportunity to work toward infusing LTSS and the care crisis into the governor's race. So I want to say we preliminarily kind of got together as a coalition around this concept of universal long-term care due to the politics of the situation, which was a new governor and a new chance to elevate the issue, because the prior governor, God bless him, this was not on his priority list. And so it was actually very much always a just trying to keep the programs from not losing funding ultimately. So the coalition coalesced around the election. It became the California Aging and Disability Alliance with about 20 member organizations, which still exists today. I do want to have a disclaimer. I am no longer a member of the coalition because I no longer work for UDW, but you know, from my perspective, having, you know, been there with the founding, I'm very happy to speak on what we did there, which was, and this is to me like what and I've spoken on this before, like it was very much around unifying around the goals and bringing all the stakeholders together and being as upfront and transparent as possible to build unity as a coalition, and to basically always stay focused on what we had in common and be constantly transparent so that we would remain trusting and build trust so that we could continue to work together and wouldn't lose each other, which we all know coalition politics can get extremely challenging with you know, various factions and politics and who's doing what and who said this and all that kind of stuff. So, I mean, in hindsight, I'm super proud that we were extremely united for at least my part in all of this. So we were able to, in the first year, so we did have some candidate forums around the election. The new governor, who obviously is Governor Newsom, did commit to creating a master plan for aging, which did not exist in the state. So that was a good step forward. We were able to win $3 million in funding in the state budget simply to expand the California Health Interview Survey, which is California's annual demographic survey relating on everything healthcare needs, just to expand it to ask questions on long-term care, because we started from the very beginning. And so we said, okay, what do we need? Like, how do we build this campaign? And so, you know, we couldn't go from 0 to 60 in a second. We had to start somewhere. And we started from, the state doesn't even collect data on long-term care needs. So let's start with that. So our first campaign was $3 million. And it's funny because our joke was we were trying to make it be like this sexy, you know, budget campaign, but it was like fund data, hashtag fund LTSS data, just, you know, because you're competing with all these controversial issues around, you know, all sorts of things that are really pressing. And we were out there, you know, fund our data request, but we got it and it was great. And then the following year, we introduced SB 512, which was a very preliminary just framework bill around a benefit. And ultimately, it was modeled after a successful bill that had passed a few years before, which was the Secure Choice Retirement Program. So California also has one of the first in the nation voluntary retirement savings for workers, basically giving all workers the opportunity to at least begin to put some money. It didn't fund anything, but it at least created opportunity for workers to start saving for their retirements. We used that model and just basically kept the infrastructure and did it around building an LTSS benefit. And the purpose of the bill wasn't to pass it and build, win it in the first year. We knew that it was about process and using the legislative process to educate, draw attention, get press, because there was so much that people just didn't even know about this issue, right? Like, I want to say fundamentally in the long-term care space, the number one problem is most people don't even know that this is a problem until it is a problem for them. And so just educating around, hey, did you know that, God forbid if something happened, you wouldn't have any way to pay for it? Like, but it was very successful in just using the legislative process. We also went back to the budget and requested $1 million to fund an actuarial analysis by the Milliman Corporation. We followed Washington State on this very closely, Ben. We said, well, we want to build a benefit. We need the actuarial analysis. We need to know how much it's going to cost, how many, people would it cover, what are our different options, et cetera. And so our second big budget campaign was around the actuarial analysis. Again, not the easiest thing to message around. How do you even explain what the actuarial analysis is around a benefit that doesn't even exist yet? But we tried to be creative and rise to the occasion, and thankfully that was funded. So that was a big deal as well. And then in June of 2019, the governor issued his executive order mandating the creation of a state master plan for aging. The administration made it very clear that they were not going to agree on anything until the master plan was done. So we knew that it was not feasible to expect a signature on any bill until we went through this new master plan process. Those of us in the coalition, a number of us were appointed to be on the stakeholder advisory committee, which was very helpful. And basically we coordinated to introduce the new universal LTSS benefit as a recommendation, which I'm happy to say was actually unanimous support for all the members of the stakeholder advisory committee. So after we did our presentations on why it was necessary, it became a fundamental facet of the advisory committee's recommendations to the administration. Obviously, then COVID happened, everything fell to pieces, everything got pushed back months and months. The final master plan was released in January. It does speak to the concept of universal LTSS benefit. It speaks in very non-committal terms. It says that the state should investigate ways to partner with the federal government on building such a benefit. It does reference the actuarial study. I don't believe that means that they would only do it if it was a partnership with the federal government. I think it just is where they are at this moment. So, it's a long process, right? Like, I think what fundamentally we have to grasp as activists in this space is we're talking about undoing, thousands of years of culture around this, which is that caregiving is a fundamentally individual family problem, an unpaid women's labor problem. So solving this is not going to be something that just happens right away. Although I have to tell you, the pandemic has been really good at bringing all of this to the forefront. I mean, it is, to me now, crystal clear, I think, to a lot more people that caregiving is a fundamental infrastructure. I love the concept of fair caregiving and the care economy as infrastructure that needs to be funded along with all the other types of physical infrastructure that exists in the country. I think that's absolutely the way to frame this. And so let me leave off by saying, this is what I gleaned over the several years of working on this very, 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 very closely. Two things. Social insurance, most people don't know what those words mean. It is extremely popular in concept. All I needed to say when I lobbied on this issue was Medicare and Social Security. And immediately, yes, this is a good thing. Republican, Democrat, oh yes, these are programs we all like. This is not scary once you explain it to me that way. Two, the issue impacts everybody. This is not a niche issue. This is not a only affects, some, remote, ultra marginalized community over here. Everybody has a relationship to this crisis. So that was also a strength, because we immediately would get, oh yes, this happened to me. This happened to my neighbor, my grandmother, my aunt. We had to sell the family home because of my, mother had early onset Alzheimer's. It immediately created recognition for the issues. So those were two main things that I would say I learned coming out of it. Dispense with the policy talk and just say, this is what the issue is. When you get sick, nobody will be there to care for you. If you need help in the home, it does not get covered by your insurance. Yes, I am aware of this. And then number two, let's do what we did in Medicare and Social Security, but let's do it for this issue. Because look, those programs work. We can do this over here. Yes. However, what I would say, the other two things that I gleaned as the negatives here, as I said before, we're talking about undoing thousands of years of cultural norms. That is very challenging. The concept that caregiving is paid labor or should be paid labor, that it is valuable, that it should be actually paid good money, extremely hard to get beyond the subconscious bias. My dog is crying in the background, so I apologize for that. He wants to go out. And then number two, which was addressed, is funding. How on earth do we fund this stuff, right? As soon as you look at the actuarials, you're like, oh my God, I think our number was like 3 billion just to do like some sort of moderate benefit. So you're immediately bowled over by the pure size of the money of it. And then it becomes, well, how the heck are we going to fund this, right? Even if we do it as social insurance, some preliminary amount of money has to come from somewhere, right? So then those, I would say those were my recognized two big challenges, was the cultural norms and the how do you fund this question. But I think once you go into it, kind of, it's like your elevator speech. You kind of get these things under sort of your 5-minute wrap, and then you start to see the words that resonate. Stick with those words. Don't stick with policy stuff. Even when you're talking to legislators, you got 5 minutes to talk to them. Make them completely understand in 1 minute what the issue is, and in another minute what you think the best way is to approach it. And like I said, we had bipartisan support for a lot of these things because it is a winning political issue. When you say to them, you will be able to go back to your district and talk about seniors getting access to services, immediate light bulbs go off. Yes, I like this. Tell me more about this. I want to know more about this. So framing it in terms of a senior issue, but I think the same thing applies for childcare. And in fact, in hindsight, really, it's a bit of a challenge because in California, the LTSS world is here, childcare world is here, and nary the two shall meet kind of thing, So how do we get to universal family care? That is a very good question that I don't believe we know the answer to yet. So that, fundamentally different kind of constituencies and stakeholder groups, how do we get them united around this as a concept?
So, Christina,
yes.
you did an awesome job of actually queuing up something that I wanted to pose to the group. And just to make sure that we do have some time.
I know, I'm sorry.
Here, I'm gonna I'm going to push in here because I think you sort of elevated something, all three of you really, that Dorian spoke about this morning at his keynote. And that is the importance of better aligning and ensuring collaboration between researchers and advocates and organizers, and ensuring actually that advocacy and organizing informs research, right? Not just that it's kind of there. You know, my impression is that there's been a little bit, this has worked a little bit better in the UFC space than in some other places. I could be wrong, but I'm curious to see how well do you think that has been the case in UFC? And more importantly, what could, going forward, we all recognize we have a moment now, as you guys said, about in social insurance and in particular in caregiving. How could we do better to ensure that organizers and advocates are at the center as we move forward to make this more effective even than we have been until now? And I welcome your thoughts. I also welcome the thoughts of other folks in the room. So.
Did you want to give Ben a chance to share Washington's experience?
But you have to unmute, Ben.
Yeah, I don't know if we'll have time to talk about Washington, but I can just tell you briefly to answer your question that surprisingly, of course, it's important, it's critical to have the organizing and the advocacy to move lawmakers. I think it's incredible. One of the things that I was going to highlight about Washington State is the importance of getting people from both parties on board. So Democrats are natural allies for these policies, but you need to have Republicans on board. That's critical for a lot of legislative hurdles that you have to get through and past. You need, sometimes you only need one, sometimes you need 2/3 of the legislature for something. And so there are, for example, to get ballot initiatives, you often need 2/3, right? And so I think organizing and advocacy should focus on getting Republican districts involved, people who represent traditionally conservative areas of states to be, they should be, the organization can focus there too, and not just in the Democratic areas. Surprisingly, the story in Washington State in the long-term care space has been more of an inside game than I would have expected when I came here. The critical players were SEIU, SEIU was really a key driver, and that was their leadership as much as the basis. But I think equally important was the concern over Medicaid long-term care spending blowing up the budget. There was a joint legislative executive committee that started meeting around 2013 to deal with that issue, to focus on that issue, and they ultimately engaged actuaries and so forth. And their concern was that Medicaid long-term care spending was long-term care spending in general, most of it was Medicaid, was about 6% of the budget in this current biennium. And in 20 years, if trends continued, it could end up being 12% of the budget, which was just unsustainable. It's unsustainable because it would crowd out other priorities. It's unsustainable because taxes are very unpopular, and in the state, as in most states. And so something had to be done there. And that was an elites issue as much as anything, as much as it was a basis issue. And that really drove the discussion around finding a new revenue source. So social insurance is critical, not just because of the we group that you can organize around. And I think that's critical as forming an identity community of a we group. So you're not talking about taking money from one group to support another group, or some marginalized group being supported by everyone, but rather everyone's in the same we group. I think that's critical. But the other aspect of social insurance that was really important was that you were bringing in a new revenue stream to pay for this benefit. So by bringing in a new revenue stream, you were solving the budget challenge that long-term care was going to pose, taking off the plates of legislators so they didn't have to worry about everything else getting crowded out or taxes having to go up. And so that's how you got, I think, a lot of people on board in the legislature who would have otherwise not supported this. And so that's a key thing that I would highlight there.
I'll just, to your question, Elaine, want to say that Christina brought up like the actuarial. I think this is where the kind of researchers and the advocates kind of meet on this is really important, because you can't move. I mean, you can, again, move a narrative, but you still have to figure out what the mechanics are of delivering on that. And so having that research base, whether it's the actuarial piece or, just again, just that deep knowledge of the way these complex policies work really does require some expertise. So you can't move ahead without having both, right? Like, you're in front of a committee, if you don't have the math, you don't have the mechanics, you don't have the credibility on all that, you aren't going to be able to move ahead. So I do think that this is an area where it's like, tailor-made. And on the other hand, even though you do all the work on constructing a beautifully designed policy, if you don't have the political will and the public will behind you, you can't move ahead. So I do think that there has been a very productive space, to Christina's point, to Ben's point about both of those parts being able to work together in these 3 pillar areas.
So I'm curious, one thing that strikes me, and I'll say I think it's maybe the only potential weakness of the 3 of you as a panel, is you're all, in somewhat from fairly to quite progressive states. So even though we are talking about the importance of bringing, I said fairly, see Deb like nodding, shaking her head at me. I'm sorry. Have you seen this other states I'm talking about? Really? We're talking about bringing Republican legislators on board, and for sure it's very important, but even those Republican legislators to some extent are different, somewhat different in those states, and certainly the ratio of them is different and how many you need. And so one question I do have for all of you is there specific advice you'd give to folks who are in very different contexts, who are working on this issue in the Deep South? Kind of in the Midwest, that's not Minnesota, if I'm going to be honest, more of the Ohio's, place Pennsylvania, where the legislature is different. And are there specific unusual allies you folks would advocate bringing on board who could be particularly helpful in those contexts? And Ben, there's a reason I'm not even asking you this question. Washington is like the poster child for being like, oh, let's pilot this awesome state thing and see if some other state will take it up. And that's a little bit true for Christina too.
Well, we're purple, I will argue. We are the only divided legislature. So in terms of our ability to move things, we have to actually run 2 strategies all the time, which is actually very challenging. And so I will say the business community is a potential. And I do think that these issues, these care issues, and the COVID has really driven home, right, how care issues impact the ability of businesses to function. And to the point made earlier about that infrastructure, our rural communities in particular really struggle with all of these care issues. Childcare is really hampering economic development in rural communities. Obviously aging in rural communities, which tend to be more red. I think that the idea of, that this is becoming, whether anybody likes it or not, to Christina's point, a public challenge and an economic challenge for states. And so I do think there's some things to work with there. Having said that, paid family and medical leave is like a red line in the sand with the business community. But I think if we think about working our way in through these other mechanisms, I do think there's some opportunities there.
Yeah, I would say a couple things. I would echo the rural areas point. And the whole eastern part of Washington is very conservative. So rural areas, so and it's true in most of the South as well, that it's true in the Midwest. Basically anywhere across the entire country, young people leave rural areas and go to cities, and the older adults are left behind in the rural areas. And there aren't good jobs, there's a lack of good jobs in those areas, and there's a lack of access to home care, and I'm sure child care as well, but that's not really as much of a problem as the home care probably. And so, I know that from personal experience with my dad being in upstate New York, that the nearest person was an hour and a half away. I had to drive an hour and a half each way to care for him. And so, framing the universal long-term care as a job creator in rural areas is definitely a good framing. And also there's been research done on the multiplier effect of Social Security spending for rural areas. Social Security Works has done a lot of work on that, and those reports could be duplicated for this space. When you do the provider, when you design the policy for long-term care, it's very important not to cut out nursing homes. In the Maine ballot initiative, they cut out nursing homes and made it a universal home care ballot initiative. That made the nursing home industry opponents of the bill. In Washington State, they were included and they became supporters of the bill. And nursing homes, particularly in the South, are very powerful politically, and so that's a big lesson. The other part is if you have the contributions be employee only. Now, I know that's obviously viewed negatively by some progressives, but economists think that it's the same thing, whether there's an employer contribution that ultimately the employee pays it. In any case, if it's employee only contribution, you're going to get a lot less resistance from the business community than if it's a matching contribution.
Thank you both. Yeah, sorry, go Christina.
No, I would add my most successful talking points when dealing with Republicans was focusing on the fact that this was middle-class families, focusing on the fact that families were losing their hard-earned assets, their house, their wealth, being forced to become poor because they had no other way to pay for the service. That resonated very strongly. This concept of somebody who had, quote, done everything right, by their philosophical definition of what that means, could now find themselves in poverty because there was nothing there for them. That was very concerning. And then secondly, what did I say? That then families couldn't leave wealth to their children. And this concept of generational, the kid does better than the parent, that this is actually preventing that from happening. That also was a very big deal. And then the focus on the budgets and on the increased state spending on Medicaid, that we don't want, Joe and Mary Smith, your middle class, did everything right, people, white people, right? Because you got to aspire to what these people care about. That Joe and Mary might wind up on Medicaid because they basically, needed services that they didn't have access to. They depleted everything they had, and now they're poor. That was like preposterous. Like, it shouldn't be that way. Like, no, how could this be? Mom and pop shouldn't be on Medicaid. Those talking points really resonated, and it's all true. So it wasn't like you're making anything up, and then find Mary and John and bring them with you to talk about it, because God knows those stories are heart-wrenching.
So you guys actually have raised something that I think is really important that came up during COVID that I don't know if we've talked about enough, and that is what is going on in the rural areas in this country. So I'd really urge us all, having worked in the kind of education policy intersection for a decade, it was remarkable how seldom, if ever, the issue of rural poverty and what was going on in rural schools came up. And that represents a huge swath of poverty in this country. Catherine, I see you have your hand up, which is awesome. You did not exit dramatically, which was surprising. Apparently we were too interesting for you. So let me leave it to Catherine to ask what I know will be a fantastic last question.
Well, I've so enjoyed hearing about how you worked, with your specific states. And I mean, you all identified constituency groups that I don't think I would have really thought of. And I'm wondering, do you have kind of a playbook of here are the key constituency groups for a universal family care, and then here is the messaging that we have found to be successful, almost like let's share notes on what were the points that resonated and what were the groups that, were harder to reach, but were just as important?
Yeah, we certainly have some of that, and we're doing a lot more work on that area. I think we're going to come up with a differentiated messaging strategy that sort of deals with the segmentation in the consumer. We call it consumers, clients, residents who would be claiming benefits, both the contributors and the beneficiaries, who are the same people ultimately, but at different points in their lives. We're going to be doing research this spring and to try to come up with personas that represent maybe 20 different types of people and how they engage and how we can message to them differently. In terms of the coalition, we have a commission that oversees the program that contains key stakeholders in the long-term care space. So W4A, the Washington Association on Aging, the AAAs, they're a key constituency. AARP, SEIU, and all of the different provider networks, home care agency providers, nursing home providers. Here we have something called Adult Family Homes, which is adult daycare, and SEIU. Those are I think the key players. And of course, the business community.
Yeah, that sounds awesome, Ben.
Yeah, sure.
I wouldn't say we have a playbook, but I do think that, it gets challenging when you're trying to message across these three things, right? And bring those constituencies together. And I would say there are a number of states, including Minnesota, that are really working with something called the preschool development grant, which is the idea is bringing together everything families need and thinking about whole family solutions. So I think if you think about all of the constellation of people who intersect with, to Ben's point at the very beginning, right? Thinking about where are those efforts where we're bringing people together across generations to support families. I think that's going to be a good space to think about how we can kind of, again, get out of our silos.
One thing I will say that's kind of surprised me is that there is push at the state policymaker or administrator level towards one benefit platform for all social programs. I thought that was something that we came up with the universal family care, and that it seemed kind of a utopian, thing that was never going to be possible. It is really hard administratively to integrate benefit programs across agencies. That's super challenging for all kinds of reasons. That's a whole panel unto itself. But there is a push for a portal. So as we were trying to do our portal in the long-term care space, we got a lot of pushback from the state saying, well, what about these other portals that are already out there? Couldn't we integrate them? Companies like Microsoft and Deloitte and others are working as consultants for state governments to try to streamline their benefit provision. So, tech is often ahead of the administrative side. So they actually are unlikely. I don't know if the tech is the ally, but there are administrators who have a vision for this. Now, of course, there's a lot standing in the way of that vision becoming reality, but that is certainly a dynamic that could push states towards trying to integrate these kinds of programs.
I'll just put in a plug for CDF. We have something called Bridge to Benefits. It's a same thing. It's a kind of a common portal, and we're under contract with our state to use that for, again, this preschool development thing. So, I mean, it is, I think it's a space where we start to think about, and also, a lot of people talk about 2 generation. I think we need to be starting to talk about 3 or 4 generation approaches. And so that's how our families see it. And so I think when we're talking about the folks who care about kids and families, younger families, tying those into the older people, I think we start to try to move to a